going to do is I'm going to introduce the panelists that we've got here, and hopefully Carly will join us. And the reason why I asked Carly here was because they're actually part of our Havering Care Association, the Lodge Group, and they have created an app called Me Passport. So this is something that's really quite revolutionising the recruitment process and bringing people on board. And I know Liz and Carly are working together as well. I'll let Liz introduce herself in a moment. But obviously that's something that's quite innovative, and it's something that we do need to start thinking about in terms of workforce and how we plan for that. So let's start. I'll introduce myself first of all. I'm Sue Jones, Director of Social Care for the Institute of Health and Social Care Management, and we have a number of questions that we are going to pose to our panelists. But what I am also going to be doing is putting those questions in the chat. And if you would like to feedback on those questions, then we would be really happy for you to do that. And please, we are encouraging you to put as much information following those questions as possible, because as I say, what we're going to do is capture this information and hopefully produce a little bit of a report that we could then actually submit to the people who are making the decisions. So first of all, I would like to introduce Ginny. So Ginny, do you want to say hello? Tell me who you are, why you're here, and what would you like to get out of today?
Thank you, Sue. Hello, everyone. My name is Ginny Collins. I work for the Surrey Care Association, which is a care association for the people of Surrey, but for the providers in Surrey, but we have very close links regionally with the Regional Care Association and nationally the other care associations across England through the Care Association Alliance. So we're a strong unifying group. We're quite lucky because our model and a fair amount of work over the last 20 years has allowed us to put dedicated resource into workforce. So I fulfill that function, and it means that we can really give extra support to our provider members across the whole sector, huge diversity there in terms of their workforce, with particular focus on recruitment and retention challenges, but trying to be solution focused as well, as Sue is. So yeah, that's me. Apart from what do I want to get out of today, I would like to share, if I possibly can, any insights and evidence that we've worked quite hard to gather for you, and always great to be sharing best practice with others and hearing how we could maybe work more together.
Super. Thank you very much, Ginny. That's great. Liz, would you like to introduce yourself, where you are, where you're from, what you want to get out of today?
Hi there, everyone. My name's Liz Blacklock. I'm initially I'm an owner provider of a small domiciliary care company in Hampshire, and we've just celebrated our 10th year. I've got a nursing background. I was latterly primary care, which is how I came into social care. Probably if I had my time again, I probably would have gone straight into social care, I think. But at the time wasn't really an option. It wasn't provided as an option. As we know, social care nursing wasn't a thing way back when. So I've had the business. We're a very small company, but we joined up the team as an employee benefit to NACAS, National Association of Care and Support Workers, to basically support and give as much support and anything that we can provide our employees, however small, however frequently or infrequently they use it. It's got to be a good thing. So we joined up, and I know that obviously NACAS, we provide a lot of membership benefits, from anything from insurance to training to retail, and then and information on good practice, a bit like Ginny. So I got talking to Paul, who's the founder, and we just found a synergy, and suddenly I found myself as the chief exec, as you do. I don't quite know how it happened, but you kind of fall into it. In between all that going on, I became involved with IHSCM and Adam, Sue's predecessor, through the people plan, and having a registration myself, as always, I've been very passionate about registration, and I've never understood why carers have never had a register. It doesn't make any sense to me, given that we're going into people's homes and working with the most vulnerable in our society. So the people plan, when it was first launched, talked and mentioned, well, discussed the possibility of a register. So we basically at NACAS and working with the guys at IHSCM, Adam, and then subsequently Sue, decided to say, you know, well, let's just do it. Let's just do it. So we've started it, and we are gaining traction. As Sue said, trying to work with Me Passport. I think, Sue, did you see she's in the lobby, Sue? Did you see that?
Yes, yeah. I've just forwarded it to Jade. I don't know why, because anyway, I don't know whether it's the wrong link.
Yeah, trying to work with Me Passport, desperate, but basically so their verification system, which is very technologically minded and way above my head. But in order to, at the moment, as we all know, we've only got DBS, and we need to enhance that verification system to ensure that that everyone's as safe as possible. So working with Me Passport, but unfortunately, as Carly will say, we're like ships that pass in the night, and trying to get time together is proving rather challenging at the moment. So but you know, onwards and upwards. So that's where we are with that. Okay. But absolutely focus. And alongside that, as we know, it's not just about verification and registration. It's about, as the reason we're here today, workforce development. Understand that social care within the public domain is very poorly or misunderstood, and trying to get people away from, you just wash your face, don't you? That's all you do. And trying to get it understood within the public is one of my big challenges at the moment, because I think unless we can get all those wheels working together, it's going to be, you know, I think
it's going to be a challenge.
Yeah. Okay. So that's where we are. Hi, Carly.
Thank you. Hi, Liz. Thank you, Liz. Hi, Carly. So glad you could join us, Carly. I know you had a few problems and you were in the waiting room. I don't know what happened there.
Yeah.
Carly, do you want to just introduce yourself, say who you are and where you're from and what you would like to get out of today?
Yeah, sure. So my name's Carly Rochester, and I'm one of the directors and co-founders of a company called Me Passport. Me Passport is a digital employment passport that is owned and shared by the social care workforce. To give you a little bit about my background, you know, a couple of years ago, if you said that I would be sort of on a technology journey, I probably would have laughed. But, you know, having worked in the sector for just over 26 years now, you know, there's a host of problems that I believe that people within the sector who are working day to day, you know, trying to provide good services and all the rest of it, have the answers to provide the solutions. Hence why we sort of went on a journey to develop Me Passport, because there is no portability of social care staff across the sector, despite the fact that in some areas there's over a 69% turnover, which basically means from one regulated service to another, we all do the same checks, we all spend the same amount of time, money, you know, all the rest of it. And we have capacity within the market, but it's not exposed because it's behind all of these verifications and validations that need to be completed time and time again. So we're sort of on a mission to empower the social care workforce with a single identity that they can share across the sector. And it builds up over time to sort of, you know, like their CV, basically. CVs are 86% lies on a recent study, but hopefully with this, because the verifications are at source, the validations within the system and their trainings and everything like that would build up over time, so they get more of a big picture rather than all starting with a new organisation from scratch. And I think that what I want to get from today is just, you know, just a conversation of how we as a sector can recognise the challenges that we have, and all get onto the same page as how we can push forward improvements, so that, you know, there's no good having a meeting for a meeting, you know, all of this sort of stuff. I'm sure we all agree. I think that, you know, part of this is the social care providers coming together and, you know, getting to a common place where we can say what can as a whole, and push that forward.
Absolutely, and thank you all so much for those words there, because I think it is absolutely so critical that we all come together, as we've all said, come together, collaborate, and really build on what we've got. We know there can be massive amounts of efficiencies and systemizations and those checks and balances that would really enable people to streamline that process. But for me, I mean, this is something that I personally feel very strongly about, because, and I say this a lot, you know, what gets me out of bed in the morning and what I'm passionate about is really making sure that care is seen as a profession people aspire to work in and be part of. Because unless we have that aspiration for people to really aspire to work in care, and we know what an amazing career profession it is from the ground up, you know, there are so many opportunities there, is how do we build that, and how do we build that workforce as well? So it's about streamline, coming together, collaborating as much as possible, but it is also around the perception of care. And I know that we did quite a lot within the people plan, and there was a number of recommendations, but it's really, as I say, how do we actually build on that? So my first question, which I'm about to put in the chat to our panel, is whoever would like to answer this question first of all, is what recommendations would you put in place to ensure good career pathways and opportunities for the future? Any thoughts on that? Liz, Carly or Ginny?
I've just turned my camera off just literally because the Wi-Fi is breaking up. So,
okay.
But for me, if I just jump in, I would say clear and accessible career pathways that are mapped across the sector, showing progression routes, training and leadership opportunities. Because often you find, you know, carers will say, I'm just a carer, and, you know, it's just a job I'm doing. It's not seen as a profession. It's already a very undervalued profession anyway. But I think if they had the vision that actually care, you know, if you're a care worker, this is your starting point and you can remain being a care worker, fantastic. But if you have aspirations to go above, like further, there are clear and accessible pathways, so they, you know, get ambition basically. I think there needs to be recognition of prior learning and transferable skills across settings and providers, rather than all of this they keep having to do over and over again, the same trainings, because it discredits and undervalues the training that they're doing, and it becomes to a provider a tick box exercise. And lastly, I would say a national framework of workforce development. So like promoting ongoing learning. You know, I'm all about portability of qualifications and celebrating professional milestones, you know, because there's no national recognition of, you know, I started here, this is where I've got to, you know, whatever else it is. So I think that for me, speaking to care workers and working with them over a number of years, I think that if they felt that their efforts in progression is aligned with some national framework and they are celebrated and it is nationally recognised, then we would get more people that have ambition and want to go on these, you know, clear career pathways.
Brilliant, thank you, Carly. Liz, did you want to come in there?
Yes, I mean, I look everything. I'm going to cop out and say everything that Carly just said. However, also I would say that it's ensuring that we start educating children. And literally what I was doing before I just came on, I've just started working with my local primary school, and I've just started a community project with my local. What does care mean? What does care mean to you? you know, start interesting them, because they don't understand. And a lot of these small children are going to have grannies, grandpas, aunties, uncles, probably all receiving care provided by myself or one of my colleagues, and not actually understanding. We've got to start, just as Carly said, we've got to start promoting it as a career that they want to go into. Everything again Carly just said. I mean, I was going to say about streamlining, so which Carly touched on, but streamlining. There are so many providers out there, educational providers, I mean, and we need to know, and which is something Carly just said, you know, that the training that's been delivered, as well as being portable, is on a par whatever part of the country you're in. And actually, you know, like any providers, any training providers, like any other, but you know, you get the good, the bad, the indifferent. But I think we need to know, have recognised, as we said, and those and skills for care, and touching on it, you're touching on it, recognise courses. I mean, I'm going back to the old days where we had the English National Board, that was a post qualification training. You know, you'd have the 998 or the I think it was the 923, and it was a recognised course that you did. And then as a nurse, I've got the 998, which is training for training and teaching and training, or the 923, which is end of life or something. And that was a portable, recognised by everyone in the country, so you could go from job to job, and you could apply for a job in Edinburgh and say, I've got this, and it would be recognised and accepted.
Yeah,
and I think
at the moment there's no consistency at all. There's no consistency of standards or consistency of the type. No. Thank you. Thank you, Liz. Jenny, did you want to come in there?
Yeah, I mean, a couple of points, and I think I'll be pulling in some of the comments that Fiona has made in the chat as well, because we're sort of aligned on this. And one of those points, really importantly, is about the parity with the NHS. So a very good starting point would be making sure that there's cross-referencing between those roles, the skills required to perform the roles, because we do know that a lot of our care workers are performing these kind of functions, peg feeding, the wound care, that they can do this, or that they may not already be doing it, but they would like to be able to do it very competently, and there is appetite there. But if their role description doesn't give them the opportunity to take on those kind of activities, it's demoralizing for them, and it's not serving the sector very well. So that would seem an obvious win, to just start doing that. And also the point, Fiona's also made something similar. I think it's about this, you don't need to just promote it. Learning and development, it's not all about getting to the next stage. It's one of two things. It could be, as I've said, just actually becoming more competent in the job that you are doing. That's going to help with retention. Some people don't want to move on, but they just want to become better at what they're doing and really optimize the care that they're giving. And then the second thing is, what about those other kind of roles that are on a par in terms of perhaps responsibility and seniority, but very different. You might, for example, have someone who's shown a really keen interest in training and think, oh, you know, I like what the trainers do, and I think I could be quite good at that. But if they don't see that they've got an opportunity to step into those kind of roles, they will look for that kind of role in a different sector, and we will lose them completely. But it would be far better to have just recognised that they had those aspirations and find a way to use that to then keep them. And yeah, so that's a whole different discussion about making space for those kind of developmental conversations, which may not be happening for some providers if they're small, you know, and they're under-resourced, they don't have a talent manager or somebody.
Absolutely. And I wonder, because I know I've actually been working on quite a bit on those career pathways, both vertically and horizontally. But also, you know, that when you think of, it's not just about the training, there's also finance, there's marketing, there's IT, you know, there's all maintenance, all sorts of different types of professions within a care setting. So it's almost, we need to really think about that, don't we? Because we want to retain people as a whole, don't we? It's not just about carers, it's really retaining those great people within the care service that is operating. So thank you so much for those comments. I am conscious that we have got another 3 questions to cover. So I am going to put this in the chat, and this is around, it's a biggie, and I was a little bit touched on before, but this is around mandatory training. So the question is, what do you think needs to change as far as mandatory training is concerned, and which areas would you prioritize? Now, I know some of it has just been discussed, but you know, let's have a discussion specifically around mandatory training. Who would like to come in there?
I don't mind if you.
Yeah.
Just really probably 2 points from me, which is I think that what we need to do is standardise the core training expectations nationally, because it doesn't matter which provider you speak to, everyone has a different set of training requirements, and it's subjective to how they read what would be mandatory or what's a recommended course or anything like that. The amount of providers that we speak to, and it's rare, to be honest, to have that standardized set of training certificates that care workers or support workers or whoever needs. And I think that's the training expectations nationally, especially around safeguarding, person-centered care, medication and communication. And then I think that's sort of underpinned for me by basically a recognised log of completed training in a central portable format, that there's trust, because more often than not you'll come across care workers or support workers, and they've done this training time and time again, and they go into a provider and the provider does not trust the training, because the reality is you can go on Etsy and print yourself off a lovely little certificate. Google, we've all got these tools now that we can do these things, but providers are spending time and resource on repeating training for their new starters or their workforce. People trying to come in or move around are repeating all of these trainings, and the problem lies within there is no central log where providers can trust, where they have the validation that this Carly Rochester, for an example, has completed these trainings to this specific standard that is nationally recognised, and they can trust it, and there's no need for that provider to repeat those trainings, because we're all risk adverse, and rightly so, because it's very important what we do. We look after vulnerable people, etc. And also, nobody wants to fall short as well with CQC. That's the threat. So I think for me, just making even those 2 adjustments would make a hell of a lot of difference
Across the board.
Exactly.
Yeah, absolutely. So that would be your priorities, is to do those 2 things. And I know that we did just get in the chat there, the NHS organisers don't recognise each other's training, even mandatory, and new starters have to do it again. And that's just unbelievable, isn't it? With so much, when it's such a simple thing, really, it is a simple thing to sort, isn't it? Just to agree those common standards and agree that this is the training program that people need to go on, and they are going to be monitored in that. If CQC were to come in, they would look at this type of information and would expect to see this type of quality of training when they go and be inspected. That shouldn't be that hard, should it? No. Shouldn't. Liz, did you want to come in there? Sorry, you're on mute.
Yeah, sorry, yeah. I've got a barky dog, that's why I'm muting myself.
Okay.
I was only just going to follow up on that, and I forgot what I was going to say now. Brain just gone. It was just about no.
The standardized training across the.
It was about standardized training, but it was also no. It's just completely gone. Okay. It was there, and I will have to come back to you. Sorry.
Okay. Ginny, did you want to add anything there?
Not really. It is hugely complex, and I've sat on committees with our partners in our local ICB. And Liz, you're welcome to take over. All I was going to say, because I haven't got much to add, other than they are struggling hugely as well. And I think there was a desire to sort of see, if this is any consolation, to see what we were doing and if we had the answers. So there you go. They're in a bit of a mess with their statutory and mandatory training as well. But the only thing that I've seen that's might be a more compelling approach would be the idea of moving on to bringing in more of a increasing the part that self-assessment plays in training, and that, you know, really thinking what is needed, and just, you know, are we over assessing altogether? But that's another massive job. But it's interesting to see some people start to raise that as a possibility.
I've remembered. It was that ridiculous funding word again. You know, I mean, so obviously we know that Skills for Care, they've just developed this amazing level 2 SAF care certificate. We agreed that care certificate wasn't good enough, so they've combined it and then promptly moved the goalposts, you know, because to make it unachievable for people like me, well, not unachievable for people like me, but for smaller providers to, you know, if you want to put everyone through that initial level 2 funding, even though you know you're going to recoup that funding back, that's still, if it, you know, the timing of everything, and if it falls around payroll or something, even just just 700 is a lot of money, and people just cannot. So they're basically not following what the ideal solution is, which I do think I would much prefer my team to go on the you know, the combined qualification, but we can't do it. So we're having to go down the old route with the levy funding, and which is just nonsense, because it's just not done in a fair and equitable way. And it's fine for those huge providers, but for the SMEs, and there again, then you lose your parity, don't you? You lose your national portability, as Carly was saying, because people just can't do it. That's what I was going to say.
Yeah, and that's true. And I mean, that is something that could be put forward. Why is it so difficult to access this learning development support scheme funding that Liz that's what you're referring to, that you claim back against, Liz? And you can, in theory, does in theory fund the care certificate, the accredited level 2, but it is being woefully untapped into, which is appalling, especially as we've learned that it is being extended, that funding. Well, it's being extended because it hasn't been claimed, any of it, because it's too difficult to claim. So it is, again, just the bureaucracy around it. And again, another one of those things that goes on the list of, this shouldn't be why things aren't working. Yeah, it shouldn't be so hard.
You know, that there are already so many uphill challenges that providers are facing. It should just not be that difficult, should it, to have that there?
I mean, you know, for a small provider, if they're already doing the apprenticeships, isn't it now, with the levy funding, why can they not take that technology or whatever you want to call it and put that into the new qualification? Because actually then you would start to get that. But I don't understand why everything is so segregated and fragmented and, as you say, bureaucratic. I've never gone down the workforce development one because it's just so time. I mean, I know it's moved on and changed now, but it's so time consuming. And I'm a tiny provider. I can't even begin to imagine what it's like if you've got hundreds of people working for you. And just it's just the bureaucracy just drives me nuts.
Yeah, absolutely. And I had a very good point from David here. David Crosby says, as a local care association, we find that some care providers won't provide training certificates to their staff as they have funded the training and feel that they own the certificate, not the staff member. And I know I've come across that as well.
That makes me really cross.
I know. And if care workers, obviously, when they move to another, it requires them to do it. And again, that was supposed to be changed years ago, wasn't it?
Yeah.
And it's not actually happened.
To me, that is just nasty. I'm sorry, that's nasty small-mindedness. I mean, yes, use paper, but they put in the work. I mean, you know, and that's surely about having people work with. It's to giving them the wings to fly. If you can say you've changed. I mean, nobody wants to lose good staff, but you know what? If you've trained them up to a certain level and they get head up, whatever, you can. And for me, that would be a sense of pride. You know, I've given them that opportunity, and they've now gone off and become administrative manager or a deputy or something. Why should, and just to say, oh, well, I pay for it, so you're not happy. I mean, that's just, oh, sorry.
Yeah, it's not how the system should work, is it? No,
No,
it's the right thing when people move on and
Yeah.
Absolutely. So there is a lot that should be being done in that respect, I think, in terms of recommendations. So that's something that we can certainly put in the document that we produce. So the third question is around recruitment, so the standardized recruitment process. So what, in your opinion, would a good standardized recruitment process look like? And again, please open this up to the floor, but I'll ask the panel first of all, what do you think a good standardized recruitment process should look like?
I think this is Carly's
Yeah.
baby, really, isn't it?
Well, I mean, I don't want it to sound like a sales pitch, but
Yeah,
I mean,
right.
you
But
know,
you have got the expertise here, Carly,
Yeah.
which is why we invited you.
Yeah, I mean, obviously, you know, we've built a digital employment passport for that very fact that, you know, if I wanted a job in social care today and I applied for 10 different agencies or providers, I'd have to do all of my checks, you know, time and time again, complete application forms, whatever else it is. For us, you know, we and I saw in the chat earlier actually that somebody said that NHS don't have a passport. They actually do. They have a passport that's rolled out across junior doctors, and it isn't working as well as expected. And the actual head of the passport, he actually contacts us to get advice, which is very ironic because you have this big idea about the NHS. Like, I'm like, wow, you're calling little old me in Essex, you know. But anyway, I mean, for us, you know, if you go through a robust, you know, onboarding experience, basically, like, you know, we have the identity system that is exactly the same for every UK practicing doctor. You know, that's now within our passport. They have a whole onboarding journey that's built to meet CQC Regulation 19, full stop, and it's built to be live, you know, linked in at source, so they don't have to keep doing these checks over and over again. And I think that, you know, for us, you know, having that standardized approach, because lots of providers that we speak to, everyone reads the CQC Regulation 19 differently. It's subjective to however you read it. And I think that by having a system like, you know, Me Passport, it takes that ambiguity away, that no matter what, everyone comes in and has a standard set of checks and validations done, and they're actually then held, owned by the actual worker, shared, validated at source, and are portable across the system. And if, you know, and our vision obviously is that Me Passport will roll out across the sector, if we spend less time on completing and repeating these checks, then we can focus on all what else needs to be done within the recruitment process, like not just compliance. You know, is this person a cultural fit to our organisation? Do they have a passion for care? Is there a potential to grow within our organisation? You know, look at more values-based recruitment rather than allocating our staff to keep chasing references all day, or looking at paper-based application forms to calculate if there's any employment gaps, or repeating training, that sort of stuff. I think that although we come about it from a compliance side of things, I think that, you know, by taking away the anxiety or stress around, you know, having to complete all of those checks in sometimes very desperate times, you know, often you'll speak to providers, and I've been in the game long enough to know that if a care worker walks in the door, they can work weekends, they can drive, and you know, you're already on a win and you haven't even gone for anything else, you know. So that scarcity of actual staff sort of creates those attitudes and those behaviours. And I just think that if we underpin the sector correctly, and we had a shared, trusted record in a passport, for an example, then we could all focus on values-based recruitment, because ultimately people are not retained within the organisation lots of times because they're just not a fit. They're just not a right fit. And it's because you've actually panic recruited because you're desperate for staff that you've ended up in this situation, and that person just ends up leaving and moves on to another organisation that's a better fit.
Yeah, absolutely. Liz, did you want to come in there?
Yeah, so a couple of things from my perspective, everything again that Carly said, but just following up on that, obviously the register comes into that standardised recruitment is having that additional verification for people, because I think it's that education in the public domain again about people not understanding what care means. So that particularly just stepping away from the verification side, but sorry, the references and so on, people think with regards to register, so why do we need to register? Because CQC register you. What people, again, the J public don't understand that the businesses, well, not every business, but businesses like ours are registered by CQC, but not the individuals that work within them. That's down to our good or not so good judgment. And as Carly says, sometimes it's because they can walk, they can talk, and they can drive a car if they're in, you know, so that's where the register comes in, because we've got no way of knowing quite who you're letting in your door. And if for those micro providers that are not registered by CQC, people just don't understand that. They really genuinely are clueless when it comes to the regulation around social care. And also, just aside from that as well, is taking the fear out of reference providing. I know that with Carly and Katie, we were working on that kind of values-based safe recruitment policy, because now, you know, when you ask for a reference, I mean, you'll be lucky to get two dates and a sickness record, and that's it. And people then don't understand that under Regulation 19, if there's a problem with the previous worker, and they were to give me a reference, so I was to give someone else a reference, and it could actually come back and be really problematic. If there's an issue with that person, we go back to the register, because there's no other way of, you know, being able to verify the VIN
And it's
number.
also important to note that England are the only one that doesn't have a register as well.
Absolutely.
Because across the other 3 nations there is.
Yeah.
Did you want to add anything in there, Jenny?
With the compliance part of it, Carly and Lizzie, you're saying that so I mean, this isn't the area I know a great deal about, but if the compliance aspect has to be completed very early on, is this going to be a deterrent to people applying to the sector? And would it be better that were happening after any kind of value-based screening took place? Because it strikes me that if you need to work quite quickly sometimes to get people to attend an interview or engage in any way with the recruitment process at the very beginning of that journey, which, you know, is a long journey, and some people find it very difficult, to hit them with, can you bring this with you, is probably going to not incentivize them to turn up at 4 o'clock on that Tuesday. Whereas if you were just to try and, you know, ease them into the concept of perhaps being introduced to the organisation, that would be more successful. And I don't know if it's just whether that's something that some providers might need some help or education about. Don't know.
What do you think, Liz? You had your hand up.
When you say easing in, do you mean about trial shifts and that kind of thing? We do that already. If people are unsure about, is that what you mean?
Would that be after they've been? Is that part of their induction process?
No, I mean sometimes we do it.
That's a good idea.
Sometimes we'll do it as part of the interview process.
Right. Yeah, no, I didn't know. Okay.
I mean, that's the way we do it. And if we're not sure, or we've got to feel, but particularly they're new to care, they may not have any, and because it goes back to what I was saying, people don't understand what care is, and it's actually a really, really daunting thing. And then just if they're a little bit ambiguous and think, well, come and do a trial shift, come see if you like it, because if you don't like it, actually that's a lot of time saved and money for them and for us.
I mean, sorry, I was just going to say, with the passport, it depends on the organisation. So we work with providers that invite their applicants to the passport, and it's up to them at what stage. People can organically join the platform so that they are work or job ready, should I say, for providers who are looking, who have job vacancies. And it depends, doesn't it? Because you can ease somebody in, but then if they've got to wait for 4 months for a DBS check, then what's the point? You know, so it's almost like they're going to need these checks no matter what. And if they have a DBS check and they decide in the end of it, social care is not for them, that doesn't lose value for another enhanced job role that they may go into. And it's their choice. The passport's been built and designed so they can actually do it in their front room at home on a Friday night, no problem, in their own time. And then they obviously hold it and it's shared around by them, by nobody else, because they're the owner of the passport. But we have just found, you know, through the build, because you know in the beginning we did it in co-production with the workforce because we wanted to make sure it was easy to use, the workforce understood it, etc. One of the biggest values that we always hear is, what, I just have to do it once and that's it, I'm not going to have to do it all of these other times. You know, lots of times you're speaking to people that have stayed in a loop of the system that they're really passionate to work in, and it's took them up to 16 weeks to get into a new role. Now for me, you know, for an example, even, you know, if I'm out of work today, I need a job tomorrow because, you know, I need to be able to pay my mortgage and feed my little maths, you know, whatever else it is. They are in the same situation. And lots of people we come across are people that don't have access to public funds. So I think this is about, you know, there is definitely a way that providers, if they want to do it part of the process and it's further down, that's absolutely fine. But this is about empowerment of the workforce, so they have a choice that they can initiate their passport and be job ready for providers who are out there, who are looking for you know, skills and ability and everything else that they've got, and they can start literally the next day or however long it takes. And I mean, just finally as well, because I will just babble on, we actually have partnered with an organisation called Flourish, and we do have a host of e-learning that is undertaken within their passport, and one of those e-learning courses is an introduction to care. So they do have an introduction to what care is if they haven't done care before.
And you know, I mean, that again is great, and it's just, you know, you need to have that consistency and that standardization of process. I mean, certainly the care providers that I speak to, you know, is the DBS checks and it's the coming back of the references. That's the bit that takes the time. So being able to simplify that is part of it. Now, there's a whole different debate in terms of e-learning and face-to-face learning. I know that there are providers out there who are really looking at making sure that they have enough interactive and reflective learning, because that's the bit that really enables people to be able to do the job that they do. So yeah, there's all sorts. I mean, I know an element of e-learning and also that face-to-face reflective learning as well. Liz, did you want to just add
just
some?
very briefly about the DBS actually, and the update service, because I know, you know, if Carly's, one of Carly's is that you have to be on the update service. But the thing that really frustrates me again is that 30-day window, which is just not always pragmatic. And if you miss that window from the certificate is issued, then that's a whole 3 years. That's another barrier to people and to providers, and the time wasted, you know, I mean, where we've, because again, if you're a very small, like ours, and you need staff, and actually waiting for however months and months it could be for DBS to come through. So oftentimes we've literally had to just literally shadow them all the time for months, so we can at least get them out doing some work, because it's just not affordable to wait, and that's a massive barrier.
Their competencies. Yeah,
exactly that. And the 30-day window is such an irritation. So that's another barrier, I'm afraid, for me.
That needs to be.
Yeah.
Carly, I'm very conscious of time, so if it's quick, I've got another
No,
question.
go
to
ahead.
ask
No,
I've got another question
Elizabeth,
to ask. So
yeah.
shall we ask the other question and then
Yes,
you say
perfect.
that at the end? Okay.
No worries.
Right. This is the final question is a really important question because this is about the well-being and support for the workforce. So the question is, what recommendations would you put in place to ensure our workforce feels supported? What would you say needs to happen to ensure our workforce are supported? Again, open that out to the panel first of all, but please do all the participants, please do feel free to type in the chat what you think the recommendation should be.
I mean, I guess the famous one that we all say all of the time is better paying conditions, but obviously that's underpinned by council contracts and, you know, whatever else. So that isn't always easy. Lots of providers are paying as much as they can, but it's just a very undervalued position or profession, if you like. I think as well, embedding sort of buddying and mentoring systems, you know, nationally that they can tap into, you know, in the early months, basically, to help new starters. Not every organisation has this, you know, the ability to know where to start with these systems. So lots of them will say, well, that's a really good idea, but they don't know how to implement it, or if they implement it, they can't sustain it within their organisation. I mean, we talk about retention, and one of our biggest dropouts are our new starters. So how do we support them and listen to them in the early months to ensure that they stay within the sector? And I think that comes to as well culturally driven leadership, you know, that listens, acts, and builds trust. You know, you don't want to have your staff worried or scared to say something because they're going to get in trouble or anything like that. You
Empowering
need to
people to feel comfortable. Yeah,
exactly, to have that open door policy, you know, where I always say to our staff, you know, nothing you're going to say to me is going to make me fall off my chair, but don't lie to me. We can work with you on anything. We can support you with anything, but we've got to start with the truth. And come in, have a cup of tea. There's no problem. You know, you're not going to get in trouble. We want people to speak. And then I think as well, like mental health and wellbeing support, so access to services, you know, that we can signpost them to, because the amount of people that you come across that are, you know, there's this cost of living crisis. Somebody come into me and spoke to me the other day about how much her electric is going up and how much her rent's going up. And, you know, she's in a job that she loves. However, you know, she's worried about her bills and things like that. And just very early on, sometimes it's just really good to let those things out. And it may be, you know, for us, we're always like, they don't want the stigma, you know, in at times where they're opening up to a face that they recognize, an actual anonymous person on the end of a phone where they can just let everything out and just be listened to and heard, is invaluable. So I think that you know, having those well-being benefits is, you know, so important.
Absolutely. And I know that there are some very good care providers out there who have a really robust wellbeing support system in place, which is great. Ginny, did you want to come in there?
Yeah, I think, you know, we do need to get some really robust data about the reasons why people leave, because we know how many people leave, but not really why. It's largely anecdotal, but that anecdotal evidence does point very clearly to poor workplace culture and communication. That's the reason most often cited for leaving. And it is within the gift of leaders and managers to do something about that for very little cost, even no cost. Carly's mentioned buddying schemes. You would do that internally within the, you know, drawing on the pool of people who make good buddies. Don't choose people to be buddies who aren't going to be good buddies. That's an important point. I've seen mentor schemes where anybody can be a mentor, and you wonder why they don't do a good job. You do need to have, you know, attributes that would make you a good buddy or leader, but you'll know who those people are in your organization. And for leaders to demonstrate, you know, it costs nothing to have a chat with a new recruit in the corridor or the kitchen, or just ping them a message, see how they're getting on, say, oh, I heard you did really well yesterday from your supervisor, well done, or how did you manage that drive, how did you manage finding this place, and I'm hearing really good things about you. I mean, it costs nothing to do any of that. And your leadership program covers that really well.
Thank you.
And doesn't, and that would be a very, people should do that one. So yeah, I think it does start with the leadership, the communication, and just remember, it's probably the things that don't cost. Who knows if the wellbeing apps are working? They don't work for me. I don't know if they work for anyone else, but
well, and thank you, Ginny. And just so you know as well, we've also got the aspiring leaders that are for the new and aspiring leaders, which really helps to bring those people forward. So it's not just about the high performance leadership. We've got these new and aspiring leaders. So hopefully that will help. Buddy systems, mental systems, there can be a really good process. So we've got some information on that. Liz, did you want to come in there?
I mean, we've said a lot of it already, but I think it's just that daily appreciation, the shout outs, the no judgment. We're all human. Everyone makes mistakes. It's how we learn from the mistakes and how we can support someone, that open whistleblowing mentality. And actually, if someone does blow the whistle for whatever, and there is, that actually that they can see it being acted on to, not just ignored. And I think that makes a difference. We've had a couple of instances where, and I think that actually also creates a strong positive culture within the team. I think just the little things. I mean, if someone's had a bereavement, just a bit like Ginny said, pop a note in the post. I did something like that this morning. If any of my team lose, I send them a little card and a little plaque, just something. And it's a little bit emotive, I know, but just something that lets them know that they're being thought of and they're not just
that you care.
And that kind
that
of
they're
thing.
valued.
Yeah. I mean, obviously, from the NACAS perspective, we have got the EAP. GP helpline, just like Ginny or Kylie said, and pick up the phone and just vent, just somewhere to signpost people to, when it's needed. Because the trouble is, as much as with the electric, with the bills and so on, and I always think, God, I'm paying that salary, my carer, but as you said, I'm paying what I can afford to pay, and I can't be responsible for everyone as much as I would love to. But it's knowing that you can actually, I can't help you there, but I can do this for you, I can do that for you, or and I think if my team, I mean, one of my guys the other week messaged me and said, my daughter's doing some homework, can you help on such and such, can you help? And so I just spent 10 minutes sending information on strokes, but I know that was appreciated, and again, that they feel that they can ask me, and I'm not just this figurehead. I think says a lot, really. So it's just making sure you're approachable and the kettle's on, and I think that was all I was going to say, really.
Yes.
And can I just add as well? We recently did a menopause awareness session, and I think it was one of our best attended sessions, because you have to be aware of the age of your workforce and what they may be experiencing. And we sort of had somebody come in and discuss with people, including people in the office who all wanted to attend, to talk about menopause awareness and what they could do and how they could manage and things like that. I think that, outside of what they do within work, recognizing things that they may be going through at specific times in life.
And quite often the carers are also unpaid carers as well. It's supporting them through that, so that there is so much, isn't there? But this is about really understanding, as you say, Carly, who you've got in your workforce. Who do you have, and what are their needs? What are they actually going through? Thank you, Fiona. Fiona, you've put support across the sector to value great leadership and positive cultures within the sector, make it greater. Absolutely. That's certainly something that we can put forward. It is around culture and leadership. Most of this is around culture and leadership, but also I should think there is quite a lot that could be done differently in terms of standardization as well. I'm conscious we've got a couple of minutes left. Liz, did you want to come in there before we?
I was just going to go back and say, actually, new starters to care. I mean, we hadn't an incident quite recently where one of our new starters came across, it was awful, like just after Christmas, an older lady doing, literally she was on her induction, and she walked into a home to find an old, with obviously a senior member, but you know, to find an older lady doing CPR on her husband and failing, and how she could have easily walked out. But again, it's actually, you take them back, you stand them down, you send them home, you listen, and we could have easily have lost her, and we didn't, because of the way you handle it afterwards, and you know, and actually, and bless her heart. I mean, I mean, given that the things that we know that we can walk into every day, and I mean, it's amazing actually that
how many come back.
It's amazing how we don't lose more, because you just don't know what you're going into every day.
No,
and that could be in the someone's home, or it could be in a care home, anything behind the closed door. So I really,
that is a testament to the absolutely amazing carers that we have up and down the UK. 100%. Okay, so we've got a minute left. Would anybody like to say final thoughts? Do you want to, anybody else in the chat wants to say final thoughts? Anybody, any part of our panel would like to say some final thoughts before we close?
I'd just like to say it just popped up for the last 2 minutes. I'd just like to say that I would really hope we can all start to get that positive message across the public sector. I don't just think within, we all know what we're talking about, but it's Joe Blogs out there who doesn't know. And actually, and again, trying to change that negative rhetoric into a positive, and positive, and start to help people understand, because unless we do that, all these jigsaw pieces are all just going to stay in a muddle, and we need to start joining them all up together. And I think that's the only way. That
perception of care and what that is. Carly, did you want to have final thoughts?
No, not really. I mean, I mean, for me, I just want to get to a place where I think that we spend a lot of time waiting for the top to do things, you know, in terms of like taking the lead from our local authorities or the Department of Health or whatever else it is, and it never comes. And I just think the sector collectively need to come together and have some sort of memorandum of understanding, you know, so to speak, to say, these are the problems and these are the systems and processes we need to put in place, and collectively agree that that's how we push forward. Because I think that if we keep waiting for the bus that just never comes, we're going to be here in 5 years talking about the same problems. And you know, we're people who are responsive and reactive and all of this sort of stuff. So I think that collectively as a sector we can change the sector. We've done with the waiting, that's done. Now we just got to move forward.
Go to your MP and make yourself a pain in the proverbial. Because actually, you know, just which is what we're having to do, is just to make, you know, I know my MP's PA hears my voice and I think she goes and hides in the dark room.
No, I'm having no joy with mine. I will keep trying, but no joy. But you know which one that will be then, won't you? Ginny, would you, you've got nothing to add? Okay.
Just isn't it amazing that we've got more and more of a platform and more voices are being heard, you know, despite just the endless challenges, and things are getting harder, and it's a different world than it was 20 years ago, 10 years ago, 5 years ago, even last year. Care providers somehow are still standing just about, and you know, and standing strong, and that's a fantastic thing. We're starting to be quite vocal about the fact that we have got solutions, and we're moving into that place now of conveying those, so that's great, and these kind of forums help with that.
Absolutely. And what I know about care providers is that they massively are able to adapt, and they have huge amounts of resilience. And I know we will survive through this. And I absolutely know that if we all come together, we will. And I know the likes of Providers Unite, I know that they're working really hard, and it is all around coming together and trying to do something collectively. Absolutely. Okay, right. Has anybody got any further thoughts in the chat? Anybody want to add anything? If you've got anything that you want to email me with directly, then I will put my email in the chat. So please do feel free to get in touch with me directly, as I say, and provide any feedback. That would be great. But thank you so much to our panelists, Ginny, Liz and Carly. Thank you so much for your contributions today. And really, well, hope that that's the last of our 3 now. So what we will do, we will go away and collate this. I don't think this is going to be done before September, I'm afraid, but we will be pulling things together. It's going to take us some time to do that. If I do get in touch with you, then obviously it's because I need some more information. But thank you again so much, and we will see you again soon.